This is breaking news from the Las Vegas Review-Journal, sponsored by Michael Gaughan's South Point Hotel, Casino, and Spa.
Good afternoon, everyone. I'm Jen coming to you live from the Review-Journal studio. We're about to take you live to the Mandalay Bay Convention Center, where Governor Steve Sisolak is expected to update us on the state's ongoing efforts to vaccinate frontline workers ahead of the full economic opening on May 1st. That's this Saturday. As you know, earlier this week, we reported that Clark County got the green light to implement its reopening plan. Under that plan, capacity limits will increase for most businesses to 80%, and social distancing rules will decrease from 6 feet to 3 feet. Also, restaurant table limits will double, going from 6 people to 12 people per table. Nightclubs and adult entertainment establishments will be allowed to reopen. The county says it will lift crowd size limits and social distancing rules altogether once 60% of county residents have been vaccinated against COVID. As of Tuesday, that figure stood at 46.5%. However, there are some concerns about people not getting their second dose of the vaccine. As of Tuesday, according to state officials, more than 120,000 people in Nevada were behind in getting their second dose of either the Pfizer or Moderna vaccine. Today, in addition to the governor, we're expecting to hear from the Gaming Control Board chair, along with MGM Resorts General Counsel John McManus and other community leaders. And so right now you're getting a live look at the Mandalay Bay Convention Center, where Governor Steve Sisolak is expected to speak here. It looks like someone is already up there at the podium. Let's take a listen.
We teamed up with our friends from the Culinary Union and really worked on this from the very early days. And I'm very pleased that we're here today with sort of the vision of vaccination being realized on this scale. From the very early days, everybody was focused on how do we get to a place where we can really end COVID, and it's obviously going to be quite a chore globally, but I feel like in our country, and specifically in this state in Las Vegas, we're doing quite well, and our objective is to get as many people vaccinated as we can to help bring this pandemic to an end. I'm pleased today that we have a number of folks who have helped the industry and our company along the way who will be speaking to you. First, we have Governor Steve Sisolak, who all of you know has been the champion for the health and safety of the citizens of our state, and particularly the workers in this industry. So we're very happy to have him here today. We also have Chair Bryn Gibson of the Gaming Control Board, who has been charged with monitoring and administering many of the health and safety aspects of the COVID pandemic for our industry. And Chair Gibson and his team have been terrific partners. We also have Virginia Valentine, who's here from the Nevada Resort Association, who has helped organize the industry. A bunch of competitors who don't always see things the same way, but under Virginia's leadership, I think the industry's done a great job of coming together on this important issue. We also have friends from the Culinary Union, and I'd be remiss not to mention our partners at Community Ambulance who've been administering the vaccines, administering tests from the very early days with a presence on our properties to help us stay healthy and safe. And probably most importantly, Delia Garcia, who's a guest room attendant at the Delano Hotel and a member of the Culinary Union. She'll be speaking today as well. So we're very happy that everyone could be here. We hope that all of you get a good chance to look at this facility, to look at how we conduct this operation. And if any of you need a vaccine, there's plenty of them to be given today. So please walk right up. And with that, it's my sincere pleasure to introduce Governor Steve Sisolak.
Thank you, John, for that kind introduction and for hosting us all here today. I said to several people, this is an incredible, beautiful facility, but I would much rather see it filled with conventioneers and customers than vaccines. And hopefully we will get through the vaccine issue in the foreseeable near future and get back to business in Las Vegas, because nobody does it better and healthier than we do here in Las Vegas. A few minutes ago, I had the opportunity to see the COVID-19 vaccination event in action here at the Mandalay Bay Convention Center, which you see right behind me. As governor, I've had the opportunity to tour a lot of vaccination sites, both in the north and the south, in the rurals, big sites, small sites, pop-up sites, what have you. And I'm always impressed, and today is certainly no different. The organizers told me a few minutes ago that they have done almost 5,000 shots in this facility. That's 5,000 needles in people's arms that get us 5,000 needles closer to what our goal is. Since the start of our vaccine effort, we have made it our goal to do whatever we can to increase access and to work towards equity. And we knew to reach equity, we had to ensure that Nevada's largest and most diverse workforce was prioritized, and as much as access to this life-saving vaccine as possible. And I think we've done that, and I appreciate the help we've got from our partners like MGM and the culinary to make sure that the vaccine is connected with the employees and the team members, because that's ultimately what it's going to take. Today, I'm glad to be here to talk about the tremendous work that's been done to protect our frontline hospitality workers in Nevada's largest industry. This effort allows us to push forward on our path to economic recovery and focus on equity and accessibility in our COVID-19 immunization efforts. And I think you've seen that throughout Nevada, that we prioritized our frontline hospitality workers because they're the ones that are going to help get the train back on the tracks and moving forward. In a moment, you'll be hearing from someone that I really incredibly admire and that has done a great job, and proud to have appointed him as chair of the Gaming Control Board, Bryn Gibson. He's been helping lead the state vaccination efforts in the hospitality industry. He's in regular communication with my team so that we can do everything we possibly can, like I said, to make sure that these folks are prioritized and get the attention that they deserve. But I want to, before he provides some specifics on the accomplishments to date, I wanted to give you a brief overview. Throughout the state of Nevada, there are currently 25 unique on-site vaccination pods, we call them, within the hospitality industry, with many running daily, at times most convenient for workers. I had the pleasure of touring one at GSR up in Reno just last week. Some of Nevada's largest employers, like MGM, have had sites open for over a month, offering vaccines to employees and their family members, in addition to their vendors and their tenants and their family members. As John said, if you're in this building and you haven't had a vaccine, you're welcome to come on down and get one, because that's what they're here to do. Additionally, MGM, along with Caesars, Red Rock, and other major gaming companies, have been expanding their vaccination efforts through pop-up vaccine locations at their various properties around the valley. And as we've learned through the pandemic, the only way to success is through partnerships, strong partnerships. That's why the State Immunization Program, Gaming Control Board, the State Pharmacy Board, and local health districts work to connect the hospitality industry with more than a dozen vaccination partners throughout Nevada. In Southern Nevada alone, we have Wynn has partnered with UMC Hospital. Caesars, South Point, and Silverton are working with Albertsons. Las Vegas Sands is working with Smith's. Boyd coordinated with Southern Nevada RTC to use dedicated buses to get workers to vaccination sites, and are expanding to an on-site pod. Golden Gaming, the Cosmopolitan, M Resort, and downtown properties like the D, Golden Gate, and Circa, and more are partnering with CVS. So the partnerships exist all over the valley and all over the state of Nevada. And this effort goes far beyond the Las Vegas Strip. As I said last week, I was able to visit in Reno the Grand Sierra Resort vaccination site, where more than 800 people in a day went through that Grand Theater to get their vaccines, customers, employees, and family members. And when it comes to the partnerships that will help ensure our hospitality workers get vaccinated, I also want to thank our friends at Culinary 226 that have been incredible partners in this effort. Well, they couldn't be here with us today. I'm grateful that the culinary and the industry have done a tremendous job of working together and communicating the importance of getting a shot and getting protected. I just had the pleasure of speaking to one of our, a young lady behind me that was a hospitality worker that just got her shot, and her husband had gotten COVID, spent 10 days in the hospital. I asked her why she got the vaccine. She said her husband spent 10 days in the hospital, and she didn't want to be in the hospital for 10 days, so she came and got her shot to protect herself, her family, and our entire community. The work being done here is tremendous, and not only helping save lives by providing a blanket of protection against COVID, but it's helping get our economy back on track. And like I say, this is the engine that drives this entire train for our state, and it's important we get our industry back as quickly and as completely, as safely as possible. People ask me, when will Nevada be back? Or when will Vegas be back? To all those who ask, the comeback is here now. We are on our way back. And we're on our way back stronger and safer and healthier than ever. Workers are coming back to the job, and they're going back home with paychecks. The neon lights are once again shining brightly, and we are on our way to a full reopening by June 1st. But in order to continue this success and reach our goal, the work being highlighted here today must continue. We're getting closer to the end than we are to the beginning, certainly, folks, but we're not done. And this work that you're seeing here today needs to continue. If you're a hospitality worker who has not yet been vaccinated, I urge you to do so. Do it for yourself, do it for your family, do it for your community, do it for your state, do it for your job. It's likely that your workplace has a vaccination site on your property. And if not, I encourage you, visit nvcovidfighter.org to find a convenient location near your home or near your work. That's nvcovidfighter.org to find a convenient location for you. If you have been vaccinated, thank you very much, but talk to your coworkers, your family members, your friends, your neighbors about getting a shot. It's on all of us to make success a comeback, to make this a comeback a success. This is our call to action, one person at a time. And again, I want to thank MGM Resorts, the Nevada Resort Association, the Gaming Control Board, local health districts, emergency management, and our pharmacy partners, and the Culinary Union for working to make Nevada the safest destination possible. And I'm proud to say we're making Nevada the safest destination possible to vacation, to come for a convention, to come for a meeting. Visitors and locals will feel protected and enjoy the benefits that the Silver State has to offer as we proceed towards herd immunity and more vaccines. Thank you to our hospitality workers, many of whom I was able to talk to today as I toured the site and different sites across the state. The Nevada experience that visitors from around the globe enjoy so much would not be possible without the men and women that are part of our hospitality industry. They're the backbone of our conventions, our renowned entertainment, our culinary expertise, experiences, and so much more. They are the fuel that makes our economy run. They are MGM Resorts. It's not bricks and mortar, it's the team members that make up this company and this industry. They're essential to our state, and that's why we have taken every measure to protect them during this pandemic, including passing some of the strongest worker protection measures and prioritizing them for vaccines. Thank you for listening and being here with us today. I'd now like to turn it over to someone who I'm extremely proud of, Chair of the Gaming Control Board, Bryn Gibson, to speak a little bit more about some of the specific work in the state, vaccine efforts for hospitality workers. Thank you all, and Bryn, it's all yours.
Good afternoon. My name is Bryn Gibson. I'm the chair of the Nevada Gaming Control Board, and I want to thank Governor Sisolak for his leadership during this incredibly difficult time for the state. I'm grateful to be here today to be able to provide a few additional examples of the way that the state, the Gaming Control Board, our state immunization program, the pharmacy board, local health authorities, local governments have worked together to help vaccinate the state's primary industry, the hospitality and tourism industry. In Nevada, the state immunization team prioritized hospitality workers well ahead of the federal government, well ahead of CDC. They knew that tourism and hospitality remained the backbone of Nevada's economy, and that these frontline workers would have face-to-face interaction with each other and with tourists from around the world and around the country. And they had to be protected as a result to keep them safe. In Southern Nevada, eligibility opened to this occupational group, we call it, on March 11th, well before the general eligibility for all people 16 and older opened on April 5th. When vaccine eligibility opened up to this critical group of frontline hospitality workers, the eligibility extended to all team members, regardless of whether they had been called back to work or were on furlough status. This was a crucial distinction, something the governor called for early on, and it was an amazing piece of forethought and foresight. And the reason the governor did this is, I mean, one, he had compassion for those who were laid off or were out of work, but in addition, he understood that as the industry came back alive, as we started to reach herd immunity, as we started to roll out vaccination, that these major properties would have to hire back in short order. And so it was going to be important to have have these people vaccinated so they could come back and start their work. As the chair of the Gaming Control Board, I've been honored to lead the vaccination effort for the gaming and hospitality workers on behalf of the state. The duties of the board, as laid out in NRS 463-0129, include maintaining the health and safety of the general population and of the industry. And while vaccinations aren't within the typical scope of what the board does or what the chair does overseas, this pandemic has made clear that in order to protect the industry, which is a primary charge of the Gaming Control Board, we had to protect the workers. That's why I was glad to see from the very earliest days so many of the operators, licensees as we call them, step forward and stand up pods, points of distribution for their employees. In many cases, they underwrote the effort, just like MGM did. They paid for it themselves. They sought out and submitted plans, applications to partner with pharmacies. They found private vendors like Community Ambulance and AMR and others, and they brought them on site and they developed vaccination programs for their staff. They, on the back end, in the back of the house, they provided signage and soup to nuts guides to help sign up for vaccination in Mandarin, Spanish, English, and other languages. They've provided flexible scheduling. They've provided paid time off in some cases. They developed PSAs and used their expertise in media to help encourage vaccination and help people understand how important it is to be vaccinated for their families and for themselves. We're seeing those efforts pay off. One of our largest operators reports that they approximate that they have roughly 60% of their staff vaccinated. Another one of the largest licensees in the state estimates that they have nearly 70% vaccinated. And these efforts aren't just happening in Las Vegas. The Strip is a focal point for discussions about hospitality in the state of Nevada, but it's happening in Laughlin, it's happening in Mesquite, it's happening in Elko, it's happening in Reno and Washoe County, it's happening in Douglas, it's happening all across the state throughout this industry. As chair of the Gaming Control Board, I am incredibly proud to be a part of this effort. We know that many hospitality workers have already started the vaccination process. According to self-reported data, as you go through the vaccination sign-up process, you self-identify, as many of you know. And through self-identification, we understand and believe that we've reached more than 100,000 people who self-identified as part of the restaurant or hospitality industries. And this is very likely an incomplete picture for the reasons that follow. I mean, first, you're talking about self-identification, so they could also get vaccinated due to an underlying health condition or due to their status in the general population, age, for example. And so, on the whole, my belief is that we've reached far more than 100,000 people through this effort, and it's been a remarkable success. We know also that our mission's not over. As the governor said, we've got to continue vaccination efforts. We've got to continue to push forward. Here in Clark County, they're trying to get to 50%. We know that population immunity or herd immunity is a larger number, and we've got to keep pressing forward and encouraging vaccination among those who are hesitant or who don't understand or don't know about opportunities to be vaccinated. With those remarks, I'd like to turn the time over to my colleague and my partner in this effort, the president of the Nevada Resort Association, Virginia Valentine. Thank you.
Good afternoon. I'm Virginia Valentine with the Nevada Resort Association. I'd like to acknowledge the governor and his team, Caleb, Michelle, Scott, everyone, and of course Chair Gibson for all of their work and tireless dedication since the beginning of the pandemic. This has been a very difficult period for all of us, and we recognize that the governor has been navigating a tricky balance between public health and the economy. Thank you for opening the lines of communication with our office and for creating a special hospitality lane and opening that. We really appreciate that, and I think it recognizes the contribution of the industry and the workers to the Nevada economy. There's no industry more excited to reopen to full capacity and bring more employees back to work than Nevada's tourism industry. Since the beginning, the resort industry's priority has been and continues to be the health and safety of our employees, our guests, and our fellow residents. I'd like to take a second and look back at what the resorts have done to get here today. During closure, the industry prioritized the well-being of their employees and their families with wide-ranging and robust support, whether voluntarily extending health benefits, continuing to pay wages, or establishing employee assistance funds. Nevada's resort industry committed to lessening the impact on its team members for as long as possible. The industry also continued its long-standing history of a strong community partner providing PPE, millions of pounds of food and other much-needed supplies to hospitals, law enforcement, and nonprofits when such items were in great demand. They established strict sanitation and disinfection measures and reconfigured their operations to adhere to recommended guidance. And they provided touchless technology, contactless options, and digital innovations wherever possible. Resorts provided free testing for employees and time off to quarantine when needed. Much of that testing happens at properties to make it easy and convenient for employees. They also developed contact tracing protocols, which together with testing helped contain the virus while we all waited for a vaccine. Now Nevada's resorts are proud to offer and strongly encourage life-saving vaccinations to employees. Most resorts offer convenient and free vaccines on site, like the one here at Mandalay Bay. In addition to MGM Resorts, other resort companies are able to provide vaccinations for family members, employees, and even community sites for the public. The resorts provide flexibility for employees to get their shot and are using creative ways to promote and reward vaccinations. In short, we are doing everything we can to remove barriers to vaccination and address hesitancy through education and peer-to-peer outreach. Have no doubt, we are focused on reaching 60%, so we can open to 100%. For our visitors, there is no greater sign of our commitment to safety than a vaccinated workforce. We are proud to work with the governor, the Gaming Control Board, the county, the Southern Nevada Health District, the Culinary Union, and the many others to accelerate our vaccination rate and protect Nevada's families and visitors. This week has brought great news for Nevada's economic engine. Our visitor numbers are up. CES has announced it will return in January. Airline passenger volume has improved, and our resorts are seeing more and more economic activity. And of course, we're on the verge of moving to fully reopening and the return of large gathering and events, which is critical to midweek business. Due to all of our collaborative efforts, event and meeting organizers and business travelers view Las Vegas as best prepared to safely host in-person conferences, conventions, and trade shows, and we can't wait to have them back. It has taken us more than a year to get here, and we are so close to the finish line, but we must keep the momentum going to reach the tipping point needed to open Nevada businesses to 100%, to bring more employees back to work, and to expedite our economic recovery. I am proud to have received my second shot this morning because I know my safety and my family's safety depends upon it. I also know it is essential for Nevada's tourism-based economy to recover. The resort industry is doing our part in Nevada, and we ask every Clark County resident 16 years and older to do theirs and join us in getting vaccinated. If you received your first shot, please go back for your second. We see brighter days on the horizon, and we are ready to safely welcome back visitors, millions of visitors who love our community and can't wait to return. And I want to thank MGM for putting this event together so I could tell you all about the industry's commitment to bringing back our employees and getting everyone safely vaccinated. Thank you very much. Governor?
Can everybody hear the question, Dana's question? No? The question, and correct me if I'm wrong, Dana, is how can we assure that people that I do want the safest destination possible, and how can we assure, since we don't have control over other states, that we have visitors coming who've been vaccinated? I can tell you I am on numerous calls every single week with the National Governors Association, with the Western Governors Association. This virus does not recognize borders. It crosses over borders. Some states are running a little ahead of others. Some states are running a little bit behind. But I'm confident that as we move forward towards June 1st, we'll have a sufficient number of people. And I'm committed to making Las Vegas and Nevada the safest place to vacation and to have a convention. And that's only going to be done through what you're seeing behind me is needles in people's arms. It's not a number necessarily. It's the advice on my medical board. I mean, we're looking at that constantly with the new CDC approvals. But what you see behind me is what's making the difference between opening up and not opening up, between people going back to work and getting a paycheck or not getting a paycheck, between having to wear a mask or not wear a mask. It's going to take more people getting shots in arms. We're still not quite to 50%. Some of our counties are at 50%, but the state is not at 50% yet, and we need to get more people fully vaccinated to get back to where we were. The solid answer is to get more vaccines in people's arms. I'm not going to give you a specific number that we need, so many million vaccines or 1.8 million. I'm not going to give you a specific number. I'm going to say we need to do everything we can to make sure that a vaccine has been made available to everyone that's eligible for it, and we get it in the arm of everybody that wants it, however long that takes. We get that with the help, hopefully, of the media, hopefully with the help of you as an individual person, getting the word out to folks that we can't get from 50% to 80% in a fell swoop by the click of a finger. It's just not going to work. It has to be done one shot at a time. One person telling their family member, telling their neighbor, telling somebody they go to church with, they go to the market with, whatever it might be, that the vaccine makes a difference. We're doing more to try to get the vaccines into the neighborhoods, as you're seeing here. Some of the bigger sites have kind of run their course. They're not getting a number of people showing up, but at the pop-up sites that you're seeing here, through the help of folks like Community Ambulance that you're seeing, what they've done behind me here, bringing the vaccine to the people as opposed to forcing the people to go to the vaccine has been effective. We're going to get the vaccine to where people are, to where people live, to where they work, to where they shop, to where they worship. And that's how I think we're going to get there. That goes back to the same question. As more people I can get in here, as I see longer lines, now this site's closed for the day, so you're not going to see any more longer lines. But the more people we can get in on a daily basis to get the vaccine, that decision is not up to me. That decision is up to the 3 million residents in the state of Nevada that are going to have to go out and get it done. We've got vaccines, we've got vaccinators through partners like Community Ambulance and the other ones I've mentioned, Smith's and CVS and all those. Now the only thing that we need is arms to put them in. So anything you can do to help us that way, to encourage your listeners, your viewers, your readers to go get a vaccine is what's going to make the difference. Okay, I think I've made my position pretty clear on the death penalty. I've made my position real clear for the last 4 years. My position has not changed. So you can go back and read what my statements are, and I'll leave it at that. Go ahead, Jeff. Boy, Jeff, I certainly hope that's not the case. We have regular consultation with our medical partners. I'm confident that the closer we get, the more people will have had vaccinated. There are some variants coming in that the medical community is concerned about. But these are not decisions, again, that I'm going to have to make. I mean, I have had to make a lot of really tough decisions for 14 months. Decisions that kept me up at night. Decisions that have caused me a great deal of anxiety. Those are the decision you're asking about, a decision that's left up to the 3 million people that call Nevada home. They're going to make that decision in terms of how willing they are to go get a vaccine. I believe in the people of this great state. I believe that they want us to open back up. I believe that they want visitors to come into the restaurants and the convention center spaces. I believe that they want Nevada to be the healthiest and the safest place to come to, and for those reasons, I think they're going to go get vaccines and we're going to be okay. Thanks, everybody.
Okay, so you just heard from Governor Steve Sisolak at the Mandalay Bay Convention Center, speaking about the state's ongoing efforts to vaccinate frontline workers. This presser is just about wrapping up, and he told us that his goal is to ensure that frontline workers are prioritized. He says they're the key to pushing forward the economic recovery by getting those workers vaccinated. And he says currently there are 25 unique vaccination pods for those workers. Some of the largest employers, such as MGM Resorts, offering employees vaccines for over a month now. He also talked about pop-up vaccine clinics throughout the valley for the public. He says the state is working with health departments and the hospitality industry, partnering together to make Nevada a priority for these frontline workers. And the governor says the state is on track for a full reopening on June 1st. And he urged everyone who is not yet vaccinated to get immunized. He also thanked those who've already gotten their vaccines. And he's working to make Nevada the safest destination for travel, for vacations, conventions, and meetings. Afterward, Bryn Gibson, the Gaming Control Board chair, also talked about the way the government and different entities have worked together since the beginning of this year to protect frontline workers, maintain health and safety of the hospitality industry. And he says many of these operators are actually paying for those vaccination pods and programs for their staff, and they're providing flexible scheduling, paid time off to encourage vaccinations, and many companies reportedly seeing 60 to 70% of their employees now vaccinated. And they are reporting that about 100,000 people in the hospitality industry have reportedly gotten vaccinated. Afterwards, the president of the Resorts Association, Virginia Valentine, spoke next, saying more resorts are offering free vaccines on site, not just for workers, but for family members and the public as well. And they're trying to find creative ways to award those who get vaccinated and to remove all barriers. She talked about visitor numbers, airline passenger volumes going up, and how she can't wait to have conventions back in Vegas, saying that we are so close to the finish line, talking about the importance of increasing the population of people getting vaccinated to 60% so that the county can reopen to 100% capacity. She also said to set an example, she recently got her second shot. We'll continue to follow this developing story for you online through our website, lvrj.com. You can also download our free RJ mobile app to get news alerts sent right to your phone. You can find us on Roku, Apple TV, YouTube, Amazon Fire, and make sure to check out our 7 at 7 a.m. and 7 at 7 p.m. show on all your favorite streaming platforms. I'm Jen Ah. Thanks so much for joining us. We'll see you in a few hours.
You've been watching breaking news from the Las Vegas Review-Journal, sponsored by Michael Gaughan's South Point Hotel, Casino, and Spa.